Good evening to everyone present here with us today. This is Shriyan from IGCP, today's moderator. I would like to welcome all the viewers who have joined our platform for better exchange of knowledge that is going to be shared by our keynote speaker, Doctor, for today's session. With much pleasure and honor, I would like to welcome a very renowned doctor, Dr. Banshi Sahu. Sir is MD Internal Medicine, FACE, PhD, RSSDI, Chief Diabetologist and Chairman of Diabetics Care and Hormone Clinic, Care, Ahmedabad. With the help of Sir and his wonderful insight, we will be taking a close look on today's topic, which is primordial prevention of diabetes. Now, without any further delay, I would like to welcome Sir at our forum and would like to hand over the session to him. Over to you, Sir.
Hello, am I audible?
Yes, sir, you're absolutely audible.
Okay. So first of all, thanks IJCP for giving me this wonderful opportunity to talk to you on next 20-25 minutes on that how we can think of primary to primordial prevention of diabetes in our country. So that's what I'll be talking. I don't have anything for this, no financial disclosure, but this is the condition which is increasing all over the world, and it is really shaking our foundation. If you just see the India reports, in 2023, we were having 101 million people with diabetes, and the global increase in diabetes condition is 45%. But if you see the India, it is 123% increase in our country. So if we really want to think of primordially preventing diabetes, then we have to intervene very early. We have to think something beyond what we are doing in our routine clinical practice. This slide you must have seen multiple times, which is International Diabetes Federation talking about all over the world how countries in different parts of the world are increasing with diabetes incidence. But if you see Southeast Asia and particularly India, the number of people with diabetes are increasing like anything. It may show that Middle East and Africa is showing slightly higher increase, but because now the new detections are more in these countries, while in Southeast Asia it is the 68% increase is there. This is the latest paper in 2023 in ICMR InDive study had shown that we have not only diabetes which is high, we also have pre-diabetes which is 136 million people. We have dysglycemia of 236 million with a hypertension of 315 million people. And what is more worrisome, we have abdominal obesity, which is a central obesity, is almost in 351 million people with diabetes. Our prevalence of diabetes is increasing in the range of between age of 40 to 45, and that sudden increase at that point of time is really responsible for increasing incidence of diabetes also, but also increasing incidence of complications in our country. And more worrisome problem is we are getting diabetes even in below the age of 30 also. So you can see here the graph starts increasing in height, and that is what really a problem for our country. It's not only the increase in diabetes which is a problem, we also have hyperglycemia in pregnancy. It means there are more persons with hyperglycemia in pregnancy is also high in our country. Every fourth woman who are becoming pregnant in our country is actually getting hyperglycemia in pregnancy too. So actually today in India, we are suffering from a condition called affluent condition, affluenza, which is responsible for increasing obesity, increasing incidence of diabetes. And that's because of we are increased caloric consumption and decreased physical activity which we have in our country. So there is at each stage of the life, there is a possibility of prevention of diabetes. And this is very important to understand that what we are doing at present is we are trying to prevent diabetes when they have accumulated risk at the age when you have multiple issues are already there at an adult life. But if you really want to prevent the diabetes, we have to work at a fetal life, which is very important. We have to work at the level of infancy or a childhood level, and at a adolescence when they are increasing in obesity because of their decreasing physical activity. So these are the stages also where we have to work if we really want to prevent the diabetes, or we can think of primordial prevention of diabetes. We all know about the primary prevention. It means someone who is at higher risk of developing diabetes or pre-diabetes. We call it primary prevention. But if you want to really prevent diabetes completely, a primordial prevention we can do only when we have to make the people normal. I mean, not to have high risk of developing diabetes. Then we can think of talking about the primordial prevention. This is very interesting data and paper. This is showing the world map, which is showing that in India and particularly in subcontinent of Indian subcontinent, we have low birth weight child. This is not there anywhere in the world. It is only low birth weight child we see only in our country, and we also have highest number of diabetes. So one side we have low birth weight child under the age of 5, which is highest in the world, more than any part of the world if you see here. And we also have highest number of people with diabetes. So it means we are capital of these two conditions. One side low birth weight, other side higher birth weight and more diabetes too. So we are actually having a small, thin, fat Indian baby. We have a small size, more fat, less muscle mass, less viscera, higher insulin, high leptin, and low adiponectin. While other side, if you see the Caucasian baby, the British baby, average birth weight of baby is 3.2, with fat percentage which is actually less than 25%. It is 15%. While the Indian baby, which is average birth weight of 2.7 kg, with fat percentage of more than 25% in the body also. So the Indian scenario is very, very different. That we get a very small, thin, fat Indian baby with constantly feeding up by the family. There is an increase in weight. There is increase in central obesity. There is a growth is restricted, but the fat part is increased all over the body. And then further urbanization, further changing lifestyle like high carbohydrate diet, sedentary lifestyle, technology dependency, inadequate exercise, more fat in belly, they are responsible for them to become more obese and to make them more prone to develop diabetes too. This is one very nice paper which had shown that how thin fat we are. If you see Dr. Yagnik with Professor Yudkin, you can see both of them have same BMI. But unluckily, the Indian person have the BM percentage fat is 21.2%, while the Yudkin have only 9.1. So this shows that even with the same BMI, we have very high fat percentage. Even he looks very lean and thin, but the fat percentage in his body is much higher in compared to the person who is Professor Yudkin. So the newly diagnosed type 2 diabetes patients in India, we get almost 2 decades earlier. We get uh, our rest ratio is higher, and we get mid-arm circumference is also low in compared to the people who are developing diabetes in the Western population. Means lower BMI, early age of onset, we get diabetes because of our fat percentage in adult as well as in young child is high. So how we have to change it? A young newborn who is low birth weight, if we continue to increase his adiposity, what we are going to get? More diabetes risk. If we increase his muscle mass, if we can increase his bony land, probably we can decrease the diabetes. So these are the two very, very important factors that you increase the muscle mass, you increase the length of the bone, that will help the decreasing the diabetes. While if you increase the adiposity risk, it is going to increase the diabetes risk. So the life cycle of a diabetes is what happens if someone who is low birth weight, a girl child become further overweight. The overweight will have more in adolescence, will become PCOS, obese, malnourished adolescent girl, and then when she will be pregnant, she will have all those nutritional issues. Plus, she is going to have hyperglycemia in pregnancy, and these pregnancy issues will lead to GDM, again a low birth weight baby, and she is going to have the same life cycle will be continued with them. So this is the one condition which is going to happen throughout the lifetime, and it's a vicious cycle which we cannot stop. The womb may be more important than home. So the healthy moms have a healthy baby. So if we can create a mother which is healthy, which is a mother which is having a normal muscle mass with more bony length, which is a absolutely well built height, and they have a normal baby. It means they can deliver a child which is with low birth weight, with a normal vaginal delivery. Probably in the next generation we can have less and less risk of developing diabetes, and it is going to have the not in one generation, maybe one or two generation, we are going to have the risk of developing diabetes in our country will become less. And this is a Barker hypothesis that adult disease are actually programmed in the environment which is developed in fetal and infant life. So this is the birth of cardiac disease. Also happens during this hyperglycemia in pregnancy. Diabetes in pregnancy is also responsible for increasing lung problem too. So what's the solution? Solution is prevention of diabetes in our country is preparing every female child for a healthy motherhood. What we have to do is we have to prepare every female child for a very very healthy motherhood. So at early childhood age, between the age of 0 to 5 years, promote breastfeeding, avoid sugar, responsive feeding, controlling screening time, risk assessment, age-appropriate physical activity, sleep hygiene, growth monitoring as per birth weight. We have to think for school-going children. Create a health science booklet, a growth monitoring, healthy diet in school canteens, discourage fast food, everywhere. Physical activity we have to increase, promote sports and screening for obesity. These school going children also we should promote health and healthy lifestyle for them to prevent diabetes. For teenager, engage them in a digital health engagement. Counseling, they are at very high risk for developing diabetes. Give them a lifestyle choice campaigns, nutrition workshop, and probably that will help them to improve their lifestyle and will improve their prevent them to get the diabetes in early years too. In a young adults, people should be incentivized. People should have a fitness challenge, comprehensive health monitoring, education on obesity, diabetes, culture of more standing, and these are the factors by which we can think of that can be how diabetes can be prevented with these young persons or who are going in the office too. Ultimate our idea is to decrease the fat percentage and increase the muscle mass, and this we have to continue throughout the life. Even someone develops diabetes also, because then the secondary prevention of complication is also very important. So preventing sarcopenia is also very important. Even someone is above the age of 45 or even above 65. So improve the health of every female child. We have to invest in every female child, and we have to improve the health of female child for the next generation to get a weight, normal birth weight of a child with a low fat percentage. At present, in primary prevention, we are talking of urbanization, we are talking of unhealthy diet, we are talking of sedentary lifestyle, we are talking of lack of exercise, stress. But we have to talk about maternal health, maternal nutrition, and in utero environment also. We know that by talking about unhealthy diet and sedentary lifestyle, urbanization, who are already at the risk, probably we are preventing obesity, preventing conversion of pre-diabetes to diabetes, and from preventing complication. But what about those people? We have to think of getting normal birth weight, healthy newborn, less insulin resistance, and less risk of obesity and diabetes. It is only possible if we can create a healthy mom and an environment, in utero environment, which will not create a baby which is of low birth weight. So it is going to have a generational impact. Not in one generation we may have the benefit if it are, but probably from one generation to the next generation, this impact is going to have, and there will be improvement in health of every female child. Will create the next generation with a normal baby, with a normal birth weight, with healthy newborn, with less fat percentage, with less insulin resistance, with less risk of obesity and diabetes throughout the lifetime. For this, we were having an opportunity to discuss our mission with our Honorable Prime Minister, President of India, Srimati Draupadi Murmu, at Diabetes India team. We made her, we had given her that how we can think of primordial prevention of diabetes for future generation. And what we had explained that if we work on the young girls who may be 10, 12, 15-year old or 8-year old, the counseling young girls to eat healthy and stay physical active, that will lead to increase in their muscle mass. If we can do make them healthy mother, we are going to have increased muscle mass, we deliver a healthy child. That if we provided them a proper food and nutrition during pregnancy, we can make them healthy school kids, including health science and curriculum, promoting sports at school level, encouraging schools to provide healthy food in canteen. We have to make them healthy youth, promoting youth to avoid unhealthy food items, to use more public transport, giving them a more regular physical activity, making them more standing throughout the day. A culture of standing we have to create in a youth and that will make a disease-free adults. Probably maintaining a good physical activity and monitoring for all NCD will make them a disease-free adults in the life. This we had also talked in 2017 with that time Honorable President of our country, Dr. Pranab Mukherjee. In last 6 years, we invested our time and energy just to educate at national level that how we can think of improving the care for these female children and how we can make them healthy mothers after 10, 15 years. So it's an invest in health of female child, inculcate healthy habits in early childhood. In school curriculum, give them a health and fitness booklet. Workplace, make of more standing culture, incentivize healthy habits. Above the age of 45, make them regular health check and prevent the complication. And above the 65, preventing them with sarcopenia. So can we stop diabetes? Yes, we can close the gates for diabetes. In every city in India, there are gates. That is what the older city used to have the boundary and there used to be gates. So let's close the gates for diabetes. And that gates used to be there for preventing getting enemy to enter inside the city. And so this is the biggest enemy of our country. Let's close the gate for diabetes. And we can change complete natural history of type 2 diabetes. To learn more, we had done a World Congress of Prevention of Diabetes just before 1 month in Mumbai, and the next meeting we will be having in South America to learn more about the prevention of diabetes and primordial prevention of diabetes. Meet us, talk to us, or write your suggestion on this mail ID. Thank you. Thank you very much.
Thank you so much, sir, for the wonderful presentation. We do have some questions from our audience if you like to take that up.
Yes.
So, sir, the first question is, what role does early childhood nutrition and parental care play in the primordial prevention of diabetes?
So it's very important because the early childhood nutrition, making them less fat, increasing their muscle mass, increasing their bony, height, will make them, a healthy young adult. And if you are doing this investment for a female child, you are trying to make their healthy mother. She is going to become mother after 20 years, maybe after 15 years. But we have to work just now. What we are doing at present is someone is 20, 25, she goes to a gynecologist or a physician that now she is going to have child, maybe after 1 year or 2 years. What doctor can do? She is already obese, she is overweight, she is having history of PCOS, some medicine, but ultimately, whatever the newborn will be there with that mother is going to have low birth weight, may not have even normal delivery also. And what we are going to get high fat percentage. So we are making the next generation also at a higher risk of developing diabetes. So if we start working now with the young children, probably the next generation we can improve.
So, there's one last question. What strategies can be employed in clinical practice to encourage perimodal prevention of diabetes in patients?
This is very, very interesting question. So, what at present clinical level, what we do? Suppose I am seeing one patient, his brother or sister are also at the higher risk of developing diabetes, and we talk to them for primary prevention. This is what the maximum doctor can do. But now we have to think that we can talk to them that your family, if you want really your family diabetes to be prevented, these are the ways by which you can prevent your family. And one of the ways is the next generation which will be born in your daughter, how we can prevent and how you can make your daughter healthy. First, you have to make her daughter healthy for making her healthy mom, maybe after 10, 15 years. It's a long course, and you are going to have your grandchild, which will not see diabetogenic risk factor throughout his lifetime. So it is something which is really very difficult to convince the patients or persons with diabetes. But yes, if we all start can talking about it, we can think that diabetes can be prevented in family also.
Thank you so much, sir. That's all from our audience. Before concluding,
Thank
sir,
you.
any message from your end?
So I think the prevention is the only way by which we can decrease the prevalence and incidence of diabetes in our country. We will not able to do only by doing a primary prevention or doing some talk or decreasing someone's weight. We have to work at primary prevention, but for we have to think beyond it. We have to think for a generational impact if we really want to decrease the incidence of prevalence. And for that only, we are making the government trying to create awareness at the level of government side that how we can think of primordial prevention of diabetes.
Thank you so much, sir, for joining us today. With your permission, I would like to conclude today's session. Thank you.
Thank you.